Dr. Lidney here. I think it's really important when we look at the skull that you have an understanding of what those foramen are all about. Okay, so this picture here is looking at a bird's eye view looking into the cranial vault. So here is the cribriform plate, right? This is part of that ethmoid bone that had the crista galli sticking up and all of the olfactory foramen, all those perforated holes. And that's where cranial nerve 1 comes through. Here's the optic canal, right? This is that sella turcica or the hypophyseal fossa where the pituitary gland is, and right in front of it is the optic canal. These are the two holes where the optic nerve travels through, cranial nerve number 2. Then we have Ross. Remember Ross, R-O-S, foramen rotundum, foramen ovale, foramen spinosum, R-O-S. And through those foramen, we're going to have some cranial nerves. Ooh, I did miss one here. I know I did Ross. Right here is the superior orbital fissure. SOF is superior orbital fissure. We taught that looking at the orbit of the eye from the front, there was the superior slit and the inferior slit. We just call them superior orbital fissure and inferior orbital fissure. So through the superior orbital fissure is cranial nerve 3, 4, 5, and 6. So hopefully you're seeing a little pattern, right? Cranial nerve 1, 2, 3, 4, 5, 6. As we move back here, 7 and 8. As we move back here, 9, 10, 11. And as we go here, cranial nerve 12, hypoglossal. So let's go through what their names are, right? So here, cranial nerve 1 is the olfactory. Cranial nerve 2 is optic. Cranial nerve 3 is called oculomotor. Oculomotor. Cranial nerve 4 is the trochlear nerve. Trochlear. Cranial nerve 5, trigeminal, and you can see it's V1. There's a V1, a V2, and a V3. In another video, I showed you that V1, V2, V3, the V is for trigeminal. Tri means 3. So the V1, which is the ophthalmic division, V2 is the maxillary division, and V3 is the mandibular division. That's the cranial nerve that goes to the face that your dentist will end up hitting with Novocaine, so half your face is numb, especially for the maxillary and mandibular division to work on the upper jaw or lower jaw. So 3 is the oculomotor, 4 is the trochlear, 5 is the trigeminal, 6 is the abducens. 3, 4, 5, 6. These are all going to deal, at least 3, 4, and 6. 3, 4, and 6 are going to move the eye. Cranial nerve 2 is for vision. It allows you to see. But 3, 4, and 6 move the eye. Cranial nerve 5 is the sensation to the eye. Okay, here's V2, here's V3. 7 and 8. So we did 6 was abducens nerve. Abducens comes from the word abduct, to move the eye outward. That's abducens nerve, cranial nerve 6. Cranial nerve 7 is the facial nerve. Facial nerve. Cranial nerve 8 is the vestibulocochlear nerve. Vestibulocochlear. And remember, here's the petrous portion of the temporal bone, and underneath it is the sensory part of the ear. Vestibular deals with balance, cochlear deals with hearing, so it's the vestibulocochlear nerve. 7 is the facial nerve that deals with facial expression, like raising your eyebrows, frowning, puckering up for a kiss, smiling. That's all facial nerve, cranial nerve 7. 7 also deals with sweet, sour, and salty, taste to the tongue, sweet, sour, and salty to the tongue. Whereas your cranial nerve 5, V1, V2, V3, that dealt with pain sensation to the face. And it also deals with the muscles of chewing. The chewing muscles are cranial nerve 5, trigeminal. Okay, cranial nerve 9, 10, and 11. So cranial nerve 7 and 8 are going through the IAM, which is the internal acoustic meatus. Internal acoustic meatus. That's where cranial nerve 7 and 8 go through. Now we have the jugular foramen, and the jugular foramen is for cranial nerves 9, 10, and 11. 9 is the glossopharyngeal. Glossopharyngeal, glosso means tongue, pharyngeal for pharynx, glossopharyngeal. 10 is the vagal nerve, vagus nerve, vagal, vagus, same thing. And cranial nerve 11 is the spinal accessory nerve, spinal accessory nerve, spinal accessory. 9, cranial nerve 9 deals with the gag reflex in the back of the throat. Cranial nerve 9 deals with the sense of bitter to the tongue. Bitter. Remember, 7 was sweet, sour, and salty to the front of the tongue. And bitter is the posterior part of the tongue, cranial nerve 9. Cranial nerve 10, super important. The vagal nerve really controls about 80 to 90% of the parasympathetics. It goes to the heart, it goes to the lungs, it goes to the stomach, it goes to your digestive organs, it goes to just about all of your viscera. It controls your blood pressure, it controls your breathing. It's everything, digestion, heart rate. Cranial nerve 10 is tremendously important. Cranial nerve 11, spinal accessory, it deals with the SCM muscle, the sternocleidomastoid, and the trapezius muscle. That's cranial nerve 11. The last one, going through the hypoglossal canal, these holes here and here, that's cranial nerve 12. That's called the hypoglossal nerve. That deals with the tongue, moving the tongue. Okay, so the mnemonic to try and remember the 12 cranial nerves is O-O-O, to touch and feel very good velvet, A-H at the end. So O-O-O, olfactory, optic, oculomotor. O-O-O, to touch and feel. So 4 is trochlear. 5 is trigeminal, to touch and. 6 is abducens, to touch and feel. 7, facial. Very good. Where am I? Hold on. O-O-O, to touch and feel. Yep. Very good. So cranial nerve 8, vestibulocochlear. Good for 9, glossopharyngeal. Very good. Velvet, vagus nerve. And then A-H. Accessory nerve for spinal accessory. And then H in the A-H, hypoglossal nerve. So those are the 12 pairs of cranial nerves, 1 through 12, always written in Roman numeral. And now you kind of understand the significance of these foramen. It's the exit route for which these cranial nerves that originate in the brain, they have to exit that cranial vault through these holes to get to their end organs to create function. That's the importance of all of those foramen.